Good afternoon. My name is Heidi Hernandez, and I am an MSOT student at Kaiser University in the Fort Lauderdale campus. Today I'm going to be reading some questions that I took as practice for the MBCOT. I'm going to be reading the correct answer and explaining the rationale. The first question is as follows. A 2-year-old client was referred to an outpatient burn clinic for management of developing scar tightness in the left hand and wrist. The client's mother is the primary caregiver and has expressed severe guilt about the child's being burned in a kitchen fire 6 months ago. The mother is feeling very overwhelmed with post-burn management program and has been having difficulty looking at the child's hand during therapy. What should be the initial program for the mother to carry on at home? The correct answer is compression glove worn 24 hours per day with silicone gel pads inserted at all the web spaces and regular playtime with Play-Doh and toy building blocks. This is the correct answer because a compression glove and silicone gel pads can prevent the developing of the scar tightness. It can help with that aspect, and the play, it's important for the mother to accept the child after the accident. Sometimes therapeutic play can help them bond again after the accident, as parents can experience um, some disconnect and feeling of overwhelm. So it is important to include play so that the mother can accept the child again. The next question is as follows. An OTR is treating a 77-year-old client who requires a resting hand splint. Which splint characteristics are most important in addressing the natural aging process of skin and adipose tissue? It will be the correct answer, soft straps and thick padding. This is the correct answer, as it is important to maintain skin integrity and prevent skin breakdown. Um, as a person ages, the skin becomes fragile, which is why this type of a splint will be the appropriate one. The next question is, a client with middle stage Huntington's disease is displaying fatigue during lower body dressing tasks. What would be an appropriate intervention strategy for an OTR to use with this client? The correct answer will be the OTR should encourage the client to take frequent breaks during lower body ADL task. This is the correct answer because the client's primary complaint is fatigue. Taking rest breaks will be appropriate. This question I got wrong because I was trying to recall what the middle stage is, but the correct answer is you have to address the fatigue. The client, this is the next question. The client, a non-driver, lives in a fourth-generation family homestead in a remote area and was referred to occupational therapy services after sustaining an above-the-knee amputation. The client is extremely concerned about community independence and being able to go shopping, attend church services, and make social visits to friends. The client has a strong emotional attachment to the homestead. Which intervention option is the best option to satisfy the client's mobility needs? The correct answer for this question was develop a community mobility plan with acceptable, affordable, and reliable transportation options for the client to access multiple goods and services in the community. This is the correct answer because the client is socially and culturally connected to the area and the family, and the OTR needs to formulate goals to optimize independence and community needs. The next question. According to Allen's cognitive disabilities model, to what type of group would clients with active acute symptoms of schizophrenia respond best? The correct answer is directive, task, and activity groups. This is the correct answer because the presence of active acute symptoms indicates limited cognitive processing. Organized activities with brief specific directions are likely to be the ones that are more successful at, therefore more participation and better results. And that was the last question. Thank you so much for listening.